I'm here with Leah Hechtman, who's an experienced naturopath. Hi Leah, how are you?
Hi, good, thank you. How are you?
Very well, thank you for your time today. Leah, can you tell me what is naturopathy?
Well, naturopathy is basically a banner term that encompasses a number of modalities. Herbal medicine is one of them. Nutrition, both dietary and supplemental, lifestyle changes, iridology, flower essences and homeopathy as well.
So there's lots involved in it.
Lots of tools,
yes.
Yes, absolutely.
And what happens in a consultation?
Each practitioner will be a little bit different, but generally what happens is that the consultation will go between an hour and a half for the first consult. Follow-ups are usually around half an hour, maybe 45 minutes, depending on the practitioner. And in that hour and a half, you're probably going to be asked things that you never thought anyone would be interested in. So the naturopath will ask you about your diet, your lifestyle, each of your body systems, any symptoms that you present with, any areas that are of concern, and everything makes sense and means something. The role of the naturopath is literally to piece together the pieces of your jigsaw puzzle and come up with a picture of what's going on with your health. In the consultation, you know, it's absolutely essential that we do some physical examination. Obviously completely clothed, nothing like that, but definitely what we'll be looking at is blood pressure, temperature, pulse. You know, you may be weighed or measured depending on what you came in for. Certain practitioners may do a urine analysis on site. They may do other testing on site depending on their skills and qualification. But certainly as well, a lot of naturopaths will be reviewing the pathology investigations that you've had done through your GP. They may be requesting some of their own as well. And it's the interpretation and piecing together of all that information that gives us more. So towards the end of the consultation, when we've extracted all that information and we've built a really good picture and an understanding of who you are, we'll develop a treatment program. And in your treatment program, depending on the expertise of the practitioner, you may find that you get various prescriptions of herbal medicines or nutritional supplementation. Most naturopaths will have a herbal dispensary, a nutritional dispensary on site, so they'll make up an individual herbal formula specific for you. So there's no sort of, you know, you have to fit the mould. It's very individual, which is, you know, an essential component of how we treat. And then they may also, within that treatment program, make dietary suggestions, lifestyle changes, various recommendations as well.
And what are some of the most common conditions that naturopathy helps to treat?
Literally anything that you'd see a general family physician for, you could see a naturopath for. We can treat anything and any ailment within the body. We can support the patient for it. But naturopathy, I guess, has its greatest foray when it helps you with specific conditions that the medical model doesn't really have any solutions for. So for example, maybe there's unexplained infertility, maybe you have PMS, maybe you can't sleep at night, or maybe you've just had a lot of stress. All of these sorts of things, the medical model, unfortunately, they don't often have very good answers, and they say just give it time. The naturopath can usually understand what's going on, and perhaps there's a strong nutritional deficiency, or perhaps your body has just been through a hell of a lot of stress and you need to retrain and rebuild it. Either way, they can usually find the answers for you and help you to actually find greater levels of health.
What should you look for when you're searching for a good practitioner?
A good practitioner, probably the easiest way to do it is to make sure that they're appropriately qualified. The general public, you know, ascertaining and understanding what that is a bit tricky, but the easiest way to do that is to make sure that they have membership with a professional association. So the main three bodies within Australia include NHAA, ATMS and ANTA. If they have a membership with the association, it means that you'll be able to get health fund rebates depending on your level of cover. It means that they'll have professional indemnity insurance, so you know that they're appropriately prepared and skilled and all those sorts of good things. But most importantly, it means that they've had the required education that's necessary. So by having the membership, it means that you know that you're not getting someone that's just done a weekend course. You're guaranteed that this person has done a minimum of 3 or 4 years of undergraduate training and potentially more.
Well, it's been really interesting and fascinating talking to you today. Thank you so much, Leah, for your time.
Thank you.